Every year, millions of older adults line up for routine checkups, believing they're doing the right thing to stay healthy. But what if I told you that some of the most common health tests after age 70, the ones your doctor says are just routine, could actually do more harm than good? What if those scans and screenings were quietly pushing you toward risky procedures, lifelong medications, or even surgeries you might not need? New research shows that up to 37% of medical tests in older adults lead to unnecessary treatments or complications, and yet 99% of seniors have no idea they're being overtested. And here's the scariest part. One of these checkups, still widely recommended, may be responsible for up to 5% of all cancer cases in the US. You won't see that in any clinic brochure. But today, we're revealing the truth. The 5 medical tests you should think twice about after 70, all backed by real science, real stories, and life-changing advice. Stick around until the end, because what's number 1 on this list may completely change how you view routine healthcare. Why do we keep getting tested more and more as we age, even when we feel fine? Because somewhere along the way, modern medicine taught us this: more tests, more safety. But for people over 70, that's often not true. In fact, there's a growing medical problem you may have never heard of: overtesting. It happens when tests are ordered without strong reasons, and they end up creating more fear, false alarms, and follow-up procedures than actual benefit. As we get older, the benefits of early detection begin to shrink while the risks of testing start to rise. Harsh prep anesthesia, radiation exposure, unnecessary surgeries. These can all hit harder on an aging body. Here's what most people don't realize: some abnormalities found on scans aren't even dangerous. They're part of normal aging. But once they're found, doctors often feel pressured to do something, and that's when the trouble begins. We'll share real stories of seniors who went through these tests and what happened next. Because in healthcare, the most powerful question you can ask isn't "what does the test show?" It's what happens next if something shows up. 5 bone density scan. Let's start with a test that sounds completely harmless: the bone density scan. No pain, no needles, just a quick scan to check if your bones are at risk. But here's the hidden truth: after age 70, this test often creates more fear than benefit. The DEXA scan measures bone strength and is used to detect osteoporosis. But in older adults, especially women, it almost always shows lower bone density. Why? Because bone thinning is a normal part of aging, just like gray hair or wrinkles. What happens next? Many seniors are immediately prescribed medications like bisphosphonates, drugs that claim to strengthen bones. But they come with serious risks: jawbone decay, severe acid reflux, and even unusual fractures in the thigh. And here's the kicker: studies show that for people over 70 with mild bone loss, these medications barely reduce fracture risk. One large study found the benefit was just 0.3% over 5 years. Let me tell you about Rose, a 76-year-old retired piano teacher. No falls, no pain, active daily. But her scan showed mild bone thinning. Her doctor started her on meds. 3 months later, she had jaw pain, severe reflux, and stopped playing piano. We stopped the drugs. Instead, we focused on food, movement, and supplements. A year later, she was performing again, stronger than ever. Moral of the story: if you're not falling or breaking bones, your lifestyle might be a better medicine than the scan. 4 brain MRI for memory loss. As we age, it's natural to forget names, misplace keys, or lose focus now and then. But for many, those small slips trigger a deep fear. Is this dementia? So doctors often respond by ordering a brain MRI, a detailed scan to check for changes. Sounds smart, right? But here's the uncomfortable truth: most brain MRIs in people over 70 show completely normal signs of aging, like mild shrinkage or white spots. They look scary, but they're often harmless. Still, once those spots are found, they spark fear. Patients panic, doctors order more tests, some even go through spinal taps or brain biopsies, procedures that carry far more risk than benefit. A 2021 study looked at over 3,000 older adults with mild memory concerns. 86% had abnormal MRIs, but only 3% of those findings were linked to real treatable problems. That means most went through anxiety follow-ups and even invasive procedures for nothing. Take George, a 74-year-old engineer, sharp, independent, just a little forgetful. His MRI showed white matter changes. He thought it was Alzheimer's. He stopped driving, stopped seeing friends. But when we tested his cognition, it was completely normal. We replaced fear with facts. We focused on brain-healthy habits, sleep, hydration, puzzles, and connection. 3 months later, George felt like himself again. Unless symptoms are severe like sudden confusion seizures or personality changes, a simple paper-based memory test is often a better first step. Don't let a scan define your mind. 3 cardiac stress tests. Feeling tired, a bit breathless on the stairs. For many seniors, those signs prompt a cardiac stress test, a treadmill or medication-induced exam meant to spot heart trouble. But here's what most don't realize: after 70, this test can easily lead you down a dangerous path. Why? Because stress tests in older adults often produce false positives. They suggest a problem that isn't really there. Studies show the false alarm rate can be as high as 40%. That means nearly half the time the test says something's wrong when it isn't. And that's where the cascade begins. Angiograms, stents, maybe even bypass surgery, all without clear benefit. A major study in JAMA Cardiology found that over half the stents placed after stress test referrals were in patients who had no real symptoms and gained no improvement in survival or quality of life. Raymond, 75, was one of them. He walked daily, felt great, but mentioned some fatigue on hills. His doctor ordered a stress test. The result abnormal. He was rushed into a catheterization. A stent was placed, and that night Raymond suffered kidney damage from the contrast dye. 6 days in the hospital and his fatigue still there, because it was never his heart. If you're not having clear symptoms like chest pain with activity or shortness of breath during light exertion, a stress test may do more harm than good. Better options: a resting EKG, a calcium score scan, or simply listening to your body. Sometimes the heart just needs rest, not rescue. 2. Colonoscopy after 70. This one might surprise you. Colonoscopy, long considered a gold standard for cancer screening, is often unnecessary and even risky after age 70. Yes, it can save lives, but after 70 the balance shifts. And after 75, for most people, the risks outweigh the benefits. Here's why prepping for a colonoscopy involves strong laxatives that can cause dehydration, dizziness, or kidney issues, especially dangerous in older adults. Sedation poses additional risks to brain and heart function, and the procedure itself can lead to bleeding or even a perforated bowel. A 2019 study of over 1.3 million seniors on Medicare found something shocking. For every 1,000 colonoscopies done in people over 75, only 2 lives were saved, while over 20 experienced serious complications. Dana, 73, had no symptoms, but a new doctor urged her to get screened. 1 small polyp was removed. That night she collapsed in pain, a bowel perforation. 9 days in the hospital. She lost 10 pounds. And she was never quite the same. She'd already had 2 clean colonoscopies. There was no reason to repeat it. Today, experts recommend stopping routine colonoscopy screening at 75 unless you have symptoms or high risk. And if you're still in great health, consider the FIT test, a simple non-invasive stool test you can do at home. No prep, no sedation, no trauma. Don't let routine testing turn into a life-changing mistake. 1 full-body CT scans. It sounds like the ultimate peace of mind. A full-body CT scan everything, catch problems early, stay ahead of disease. But for people over 70, this test might be the most dangerous of all. Here's the shocking truth. Full-body CT scans expose you to high levels of ionizing radiation, up to 500 chest X-rays in 1 session. And new studies now estimate these scans may be responsible for up to 5% of all cancers in the US. Yes, the very scan meant to protect you could be triggering the disease you're trying to prevent. And most of the time, these scans don't find anything serious. Instead, they find tiny, harmless nodules or spots common in aging that spark a wave of panic, more scans, biopsies, or even unnecessary surgery. Marcus, 80, was fit and still teaching martial arts to seniors. He felt great, but a high-end clinic offered him a premium checkup. His scan found a 3 mm lung nodule. That led to a PET scan, then a biopsy. The result, benign, but the biopsy collapsed part of his lung. He spent 2 months recovering. For nothing. Leading medical bodies, including the American College of Radiology, strongly advise against full-body CT scans for healthy people without symptoms. If you're feeling well, skip the scan. Save your energy and your body for the things that truly matter. Because sometimes the best test is knowing when not to test. If you're over 70, the real secret to staying healthy isn't more testing. It's smarter decisions. That starts with asking the right questions. Before saying yes to any medical test, pause and ask, if this test finds something, what happens next? Will it actually change how we treat your symptoms? Is the next step safe? Or could it lead to stress, side effects, or even surgery? Too often tests are ordered out of habit, not necessity, but you have the right to pause, to think, to ask. Second, shift your focus from screens and scans to lifestyle. Because the truth is, how you live matters more than what a test says. Move your body every day, even gentle strength exercises or a short walk make a difference. Eat real food, leafy greens, beans, nuts, fish, whole grains. Drink water, sleep deeply, connect with others, laugh more, worry less. These choices protect your heart, your brain, your bones, and your joy. Third, not all tests are bad. Simple blood pressure checks blood sugar, kidney function. These can catch real issues early with almost no risk. The FIT test for colon cancer. It's a safe at-home option. Vision and dental exams. Don't skip those. They protect quality of life. And finally, if a doctor recommends a test and your gut says something doesn't feel right, listen to that. Ask for a second opinion. You are not being difficult. You're being wise. You're being careful. You're protecting the years you've worked so hard to earn. Because at this stage of life, your most powerful medicine may not be in a test result. It's in the choices you make every day. So there you have it, 5 medical tests that after age 70 may do more harm than good. Not because they're evil, not because doctors don't care, but because medicine isn't one size fits all and aging bodies deserve a different kind of care. Modern healthcare is powerful, but it's also imperfect, and sometimes less testing means more living. Every test you say yes to should earn its place. If it doesn't clearly protect your health, improve your life, or offer peace of mind, it might not be worth it. You deserve healthcare that's thoughtful, not fearful, that respects your wisdom, your time, and your right to choose. So here's what I want you to remember. Ask better questions. Live like your choices matter, because they do. And never ever hand over your health out of fear. If this video resonated with you, please share it with someone you love. A parent, a friend, a neighbor who may be facing one of these tests. Leave a comment below. Tell us your story. Have you ever had a test you later regretted? What helped you heal? And if you want more honest, science-backed health advice made for seniors like you, hit subscribe. We make these videos for you because you've spent your life giving to others. Now it's your turn to protect your time, your energy, and your freedom. Even 5 minutes a day, the right 5 minutes, can change everything.